Hello, this is Park Sang-ho from Royal Animal Hospital. Today, I will share what you must absolutely follow when your dog begins fighting cancer. When your dog is diagnosed with cancer and undergoes surgery, after receiving major medical treatment such as surgery, there are many cases where herbal medicine is given to help with recovery. However, feeding cabbage instead of meat is very important for a dog battling cancer. I will explain why that is. At our hospital, we remove mammary tumors without anesthesia or surgery. Afterward, to manage metastasis and recurrence, we perform these three procedures. The first procedure regulates the three channels. Secondly, we are giving supplements that suppress cyclic pigmentation. And thirdly, to boost immunity, we are using the NKS activation method. Among these, the most important is actually this SAMDO regulation. If SAMDO regulation is not achieved, it will effectively become anti-cancer treatment. The remaining treatments 2 and 3 won't have much significance. In fact, the pH of the blood is the biggest factor affecting cancer growth now. The blood is in a slightly alkaline state, with a pH of 7.4. However, even if it slightly deviates from 7.4 to around 7.2 or 6.9, even if the blood becomes slightly acidic, this phenomenon occurs when the cell's DNA repair is impaired. When DNA is not properly repaired, it leads to the development of cancer. A case with a similar result recently visited our hospital. They came all the way from Canine. It was a 16-year-old male Maltese that weighed 2.8 kilograms. A mast cell tumor developed in the left thoracic region. Therefore, we performed surgery to remove this tumor in May. And since it was actually a low-grade mast cell tumor, no other special treatments were administered afterwards. After that, about 3 months later, around the end of August, I had surgery. I went to the hospital where I had the surgery. They recommended chemotherapy, but the guardian said that the dog is a 16-year-old small dog. They did not want chemotherapy. They came to our hospital to only remove the mass. As a result, the cancer treatment at our hospital did not involve surgery to remove the tumor. This is the blood test result conducted at Meja Animal Hospital just before the surgery on May 1st. Looking at May 1st, the kidney values are very good. Despite being 16 years old, the dog's creatinine level is 0.9, indicating very good management. The BUN level is slightly elevated, likely because the dog has been eating some meat recently. And if you look here, GZ is the relevant measurement. It is considerably high. The blood test results suggest that this individual has been consuming meat for a very long time. Fortunately, looking below, the maximum values and such don't show significant abnormalities. Although the blood sugar is slightly high, it should be considered a manageable level. Since this caregiver also underwent surgery at the hospital, they struggled as well. Let's eat some meat to regain strength. That's why they continued eating chicken breast from May until the strike while visiting our hospital. And then finally, they treated the mast cell tumor like this. They wanted to remove the mast cell tumor at our hospital without surgery. The problem is that the blood test results from August 29th showed that the creatinine level had now risen to 3.4. And the non-fasting glucose was 80, and the SDA was 18. This corresponds to stage 3 kidney failure. Perhaps this relates to the surgery preparation and the antibiotics taken during that time. It is believed these factors had some impact, but the biggest problem appears to be that Zhang Ji ate chicken breast. The BUN level, which indicates the progression of kidney failure, has already exceeded the normal range. After long-term consumption of a bland diet, the liver enzyme levels now indicate acute liver failure. Those enzyme levels have increased to more than double their previous values. Lipase, amylase, and cholesterol levels have all increased, suggesting that pancreatitis has recurred. The patient came for mastocytoma treatment, but their kidneys were completely damaged within 3 months. There was nothing that could be tried for the treatment of the intractable tumor. Actually, since there is no facility in Canine, you should return to your region and first receive kidney fluid treatment. I advised you to first correct the kidney function levels. Usually, when you have a dog for a long time, we usually perform a health checkup about once a year. When a dog passes away naturally without any special incident, the organ that mostly determines their lifespan is usually the kidney. If nothing special happens, you can think of the health checkup as one to protect the kidneys. because when a situation arises that causes physical stress like this, you need to take medicine to cure the disease. If the kidney function deteriorates this badly, in fact, no treatment can be performed. When cancer occurs, dog owners usually think that once the cancer is removed, it's over, but you shouldn't think like that. Regardless of the child's age, if they previously had a very healthy body where cancer could hardly survive, but now some type of cancer has developed, you should recognize that the body and environment have become conducive to cancer survival. The first thing to do is, you need to apply treatments that transform the body from one that cancer thrives in to one that cancer struggles to survive in. If you believe that just removing the tumor and doing anti-cancer treatment without these measures will make your pet better, there is some misunderstanding about cancer. If you have begun cancer treatment, or if I have treated many hard-to-cure cancers, when treating dogs with cancer, the harmful impact of meat is significant. You should reduce meat intake somewhat. Simply doing this can significantly improve the outlook of cancer treatment. Unfortunately, because this is often neglected, many pets are lost due to metastasis and relapse. The reason I specifically make these videos is that usually, whether at a university hospital or a secondary animal hospital, they focus a lot on treatment. However, fundamental aspects like pH control or pH management are rarely addressed. If a dog has cancer, they generally recommend a meat-based diet. If possible, it's best to feed the dog cabbage. We can't continuously track whether the pH of the food the dog ate is exactly 7.4. So the approach is to maintain alkalinity rather than acidity, which is actually a success. For meat-eating dogs, if you apply litmus paper to their saliva, this way, you can indirectly check the dog's body pH. It only costs about 501 and allows for roughly 80 tests. If you apply litmus paper to saliva, it turns yellow, showing the body is acidic. When eating cabbage and following a vegetarian diet, it turns very green, indicating alkalinity. Even monitoring just this much can be a significant milestone for treating injuries from cancer, surgeries, and managing cancer recovery afterward. Therefore, it is actually difficult to expect good results without controlling the three factors. If beginning cancer treatment, you need to choose meat consumption. Although it might be challenging, adjusting the timing of feeding cabbage is very beneficial for your dog. Thank you.